Hey, I'm Tyler Wilde, here with Dr. Caitlin McGee, physical therapist, who's been talking to us about ergonomics. Caitlin, I wanted to talk first of all about what the common causes of wrist pain from people who, you know, use a mouse and keyboard often, and if it's always serious.
Sure. So when it comes to wrist pain, I think the big thing that we all worry about or think about first is carpal tunnel syndrome, right? It's the big like boogeyman of gaming and programming industries. And the good news is most of the time, folks don't have carpal tunnel. However, the kind of classification that injury falls into is a repetitive strain injury, and that's the kind of thing that we do see a lot of, even if it's not that specific type of repetitive strain injury. Repetitive strain is exactly what it sounds like. It is the same amount of strain. It's a similar amount of kind of buildup of strain over time, which leads to more work than the tissue is ready to handle. And I'm being kind of vague because it really does depend on the type of tissue involved in terms of what work means. Um, Strain involves a whole bunch of different factors. It involves what position your wrist is in. It involves how much conditioning, how much endurance the stabilizing muscles there have. Involves how much movement and what type of movements and how frequently you do them at various joints. It involves how much force is being applied. All of those factors add up together to build the total like strain or load on a tissue. So in general, the more time you spend doing the same movements with similar amounts of force in similar positions, the more strain you're building up. Uh, that's probably makes a decent amount of sense. Increased strain doesn't inherently cause injury, so you are not guaranteed to get an injury or even guaranteed to get pain if you make these repetitive motions. You're just at slightly elevated risk if your body isn't prepared to take on that strain. So think about it like a marathoner, right? A marathoner doesn't just go out and try and run 26 miles at a time. They spend months building up their tissue to be ready for that amount of strain. Now, I'm not saying that every gamer or computer office worker needs to take on a comprehensive training routine in order to be prepared for the daily grind, but you can use the same principles to build up the strength and endurance of your tissue.
So I assume if I'm experiencing like really severe or worsening pain, the next thing I should do is probably consult with a doctor or a physical therapist like yourself, right? But if I'm just sort of have a bit of an ache, are there
Mhm.
things I can do? You just talked about exercise, but are there some specific things I can do to try to correct this and see if it improves?
Sure thing. Obviously, yes, if your pain is severe or long lasting, or you've tried some things at home and it's not working, definitely great to consult a professional. If it's just the beginning of pain, that's even better a time to intervene than once the pain's gotten severe. The earlier you intervene, especially if you're preventing, even rather than intervening, the better off you're going to be and the easier it's going to be to recover. So there's a whole bunch of factors we want to look at, right? Let's break them down by what we talked about with strain. First one, what position is your wrist resting in? A lot of the injuries that I've seen as a clinician when it comes to wrist pain have had to do with resting position of the hand. So a lot of folks will rest in what's called ulnar deviation, which is when their wrist is slightly tilted out towards the pinky side. More rarely, we'll see what's called radial deviation, which is tilted in towards the thumb side. Most often, we see that radial deviation or that ulnar deviation on the mouse hand and that radial deviation on the keyboard hand if you're someone who likes to turn your keyboard entirely sideways. Please don't do that. When your wrist is out of this nice neutral middle position, you're putting either stretching or compressing stress on one side of the wrist or the other. Over time, that's just one extra piece of strain, one extra load that those tissues are having to take on. It's a very easy one to remove by just working on having your wrist rest here. That doesn't mean that you can't, flick to the right, flick to the left. Totally fine. You have to do that for gaming, in fact. What we don't want, though, is if you're resting already in this ulnar deviated position and then you try to move further to the right, one, you've got very little space to go, so you're going to have a hard time making a good movement in the first place. But two, you're going to be closing down this space and applying even more strain. So a good first step is check out what your ergonomics look like. Is your wrist resting in a neutral position more often than not? Thing number two, look at how well conditioned are the muscles that move and stabilize the wrist. That's where that exercise we talked about comes into play. You don't need to be able to, do a wrist curl of, I don't know, 20 or 30 pounds. You need to be able to do a lighter weight for a longer period of time. If you don't have weights at home, doing isometric exercises can be a good option. Isometric exercises are ones where you contract but don't go anywhere. So, like if you're trying to do a bicep curl, but something was blocking it. Contracting and holding is a really good way to work on strength and endurance without having to go through a painful range of motion. And in fact, it's one of the things that we frequently prescribe as part of the beginnings of an exercise program for patients. Then we want to look at how much moving you do at your wrist. Are all of your movements coming from your wrist? Do you ever use your elbow or your shoulder for movements? We're not suggesting that you have to change your entire play style, but consider if you're consistently getting strain and stress in the short term, you might want to use some more elbow-based or shoulder-based movements while you're building up your wrist to be tolerant and conditioned to handle that amount of work. Then you want to look at how much force you're using. And this one comes into play a little bit more with clicking or with hitting buttons or hitting keys on a keyboard. With keys on a keyboard, there is some extent to which you can't entirely control it, right? Your key attenuation force is kind of programmed in when you buy the keyboard. But you can definitely strike with more or less force. And a lot of the time, when we're hitting things harder with kind of tighter contractions, it's because we're anxious, we're stressed, we're really hyper-focused on competition. So that's one of those times that actually physical exercise will only do so much. And instead, working on emotional regulation and kind of mental focus will actually help you with physical pain.
So I'm potentially increasing my risk of injury if I'm typing angrily and in an irritated mood.
Exactly. You just yell at, a rubber ducky sitting on top of your computer and then type a nice calm email afterwards.
Well, that is good advice, and the rest of that's good advice. And we couldn't be comprehensive here, but you have written 2 articles on PC Gamer. If you go to pcgamer.com/health, you'll find all of the articles Caitlin's written, as well as some other ones. So look for the ones about identifying causes of wrist pain and what to do about wrist pain for more advice. And there are actually some images of some of these exercises that you've described to help people. All right, thank you so much.
You're welcome.